Hello, I'm Professor Michael Chi, and together with Dr. Jism Yilmaz, I'll be speaking on Beyond Sleep, other health applications of wearable trackers. I advise for Aura Health, but the company had no influence on the content of this presentation. Now, if you've recently acquired a health tracker, either on your finger or on your wrist, you have just purchased a veritable portable health lab. And this is because of the multiple sensors that are in these devices. The three principal ones are a 6 or 9D accelerometer, which measures linear motion, rotation, or orientation in three dimensions or planes. The PPG or photoplethysmograph, which measures your pulse rate variability, and oxygen saturation, and a temperature sensor measuring distal body temperature. In addition, depending on the product you've purchased, there may be other sensors with other functions. Regardless, these three primary sensors are responsible for most of the algorithms involved in sleep or wake detection and sleep staging, as you've heard earlier, and also for physical activity tracking and exercise performance evaluation. In this talk, I'll be talking about 5 other applications: cardiovascular or metabolic health, mental health, menstruation and fertility tracking, infection or inflammation, and physical activity or sedentariness. Applications can be directed to 3 buckets, each of which serves a different purpose with a decreasing number of benefactors. The value of the health tracker for each application will differ for each bucket because of Bayes' theorem and differing sensitivity and specificity for each sub-application. Tests are best when sensitivity and specificity are high and the condition of interest is common. These 4 use cases, color gradient coded, give a sense of the utility of each sub-application according to this principle. We will revisit each of these during the talk. A point I find completely underappreciated by many medical professions is the richness of the time series data associated with each sensor. These data streams interact with this data stream can interact with other data streams, and it is also important to know how well the phenomena of interest and its associated relevant information is collected and analyzed. To fully utilize such high-dimensional data when it's collected with good quality and quantity will benefit from machine learning that is thoughtfully applied. Here is a demonstration of what I just said.
Here's a data set where lots of people wrote digits between 0 and 9. People write in all kinds of ways. So the question is, instead of us needing to manually code rules for all the ways people write, could a machine figure it out itself using machine learning? Each image is 784 pixels. The computer treats each pixel as a dimension. Again, using T-SNE, it clusters these images in a high-dimensional space. We've color-coded them so that it's easier for us to see what's going on. And you can see groups of digits clustering together. It's learned something about the meaning of these digits.
The point is, if we want to benefit from high-dimensional data, we need to be willing and able to think differently. With that background, this talk will discuss the 5 applications that I mentioned earlier with roughly this framework. We'll give a background, example studies, and then end with a section summary. Probably the largest and most beneficial segment application is cardiovascular or metabolic health. Before I begin to talk about applications, I want to say a few words about the measurement of heart rate variability with PPG. The reference device for measuring heart rate or heart rate variability is ECG, and done properly, that gives very high quality recordings. PPG signal is far noisier than measuring ECG, so the technical details that manufacturers don't tell you about can very significantly determine the signal quality and then the quality of the inferences that are downstream from this. For example, the location of the sensor is important because the finger is better than the wrist as shown in this world. The sampling rate, collection interval, and other details are also important. For the user, it is important to ensure that the recordings for resting heart rate don't occur during movement. Well, the algo is supposed to take care of this, but how well the device is worn to ensure good skin contact is something that the user can help with, and this is an example of a poorly worn device. A question that I get asked often is whether skin tone is important for the analysis of heart rate variability. It's not important for that, but it is important for assessment of oxygen saturation. Wearable health trackers need to measure pulse rate accurately if you want to make good inferences. I've made this point in the previous slide, but it's worth mentioning again. Members from our lab have demonstrated that a consumer device can give you very accurate readings. Here you can see very close correlation, 0.99, between the ECG measured heart rate and a consumer device measured heart rate variability. This is the root mean square of successive differences, and this is the spectral analysis of the heart rate data. Another group recently tested multiple devices, and you can see that the mean absolute errors between the devices do differ, and perhaps easier to appreciate is the mean absolute percentage error, which can vary almost threefold from the top device and the least accurate device. Now, this is one study, so the results could differ between studies, but it is important to realize that not all the systems are the same. Not all manufacturers put out similarly accurate devices. Now, given that caveat, we can now talk about the resting heart rate, which is the best established cardiovascular risk marker. Resting heart rate measured episodically predicts cardiovascular and all-cause mortality, and you can see that it affects even cancer and other cause mortality. Now, this is the inference you can make from a single measurement, but also if resting heart rate increases over time. Let's say a 5 beat per minute increase over years, or even bigger, these indicate higher all-cause mortality. So the trend as well as the current reading matter. The measurements taken in this large-scale study were made using ECG in the daytime. However, if you want to get the best readings, resting heart rate should be measured during quiet rest or preferably sleep where there's less movement. Note that readings are also affected by medications, medical conditions, and a slew of factors that I'm going to show you in the next slide. So age can affect resting heart rate. If you're obese, resting heart rate tends to be higher. If you're asleep, resting heart rate tends to drop. If the standard deviation of the resting heart rate decreases with age, and you have seasonality effects with the heart rate being low in the resting heart rate being low in the summer, and perhaps because of the revelry from drinking and partying in during Christmas, heart rate's higher. Wearable based heart rate can also be used to assess risk of metabolic syndrome. This was a study where Fitbit data obtained from over 500 middle-aged adults informed about the risk of metabolic syndrome. In men, elevated heart rate, all-day sleeping minimum and inactive indicates risk for pre-metabolic and metabolic syndrome, whereas in women, a slightly different set of factors was significant. And in both, accounting for covariates reduces the risk prediction, suggesting that these covariates, including age, body mass index, education, and smoking and alcohol, can contribute, they do contribute to the risk. There are temporal aspects of the heart rate changes to consider. What I spoke about is generally long-term trends occurring over months or years, and these give a sense of overall cardiometabolic health, general health, and whether there is a change because you took some new medication. Over the medium term, an acute illness like a flu, extreme fatigue, or stress could affect resting heart rate. And in the short term, we all know that if you just received word about your grant, your heart rate will go up. So there's baseline data, there's trends, and there's dynamics to consider. I skipped by that slide about heart rate variability, but it's because it's a measure that was spoken of earlier, and also because it's quite difficult to use that data on its own, and I'll summarize later in the summary slide. The application I want to talk about is atrial fibrillation. Atrial fibrillation is an arrhythmia that significantly increases the risk for stroke and related heart problems. And we have now as of end 2025, five devices that are US FDA and CE marked for this application, and these are 4 of them. This is an example of a large-scale study, the other large-scale one being conducted by Fitbit, showing the hundreds of thousands of participants who were polled, and those receiving a notification of an irregular pulse were studied with an ECG patch, the gold standard for measuring atrial fibrillation. And this was done over quite an extended period. The bottom line is that among participants who received a notification of irregular pulse, about a third of them had atrial fibrillation. So there are other causes for irregular pulse, such as ectopics, which are atrial or ventricular ectopics, which are more benign. And also there are some instances where artifacts, poor recording, gives rise to these notifications. Assuringly, 84% of the notifications were concorded with atrial fibrillation detected on ECG. Now, because of the nature of this application, which is for screening, there will be false positives. And this has irritated some cardiologists, but perhaps the overall benefit of detecting atrial fibrillation will outweigh some of this extra work and anxiety created by false positives. Here's a study reported in 2023 about the 5 FDA-approved devices for measuring atrial fibrillation, and you can see that they all have quite respectable sensitivity and specificities, which do differ across manufacturer. There's data about preferred choice and also the limits of heart rate interpretability. Of these 5 devices shown here, 4 of them are consumer devices that provide information other than atrial fibrillation or just the cardiac information. Now, exciting new application for wearable health trackers is that they may assess vascular aging, which refers to alterations in arterial structure and function with aging. PPG signal can be used to assess two aspects of vascular aging: hypertension and arterial stiffness. The benefit of having elastic arteries is that they will cushion the impact of ventricular ejection. Stiff arteries also tend to be part of a vascular system which is involved, which is a hypertensive one. Elastic arteries reduce perfusion related damage, and during the diastolic phase you get improved diastolic flow if the arteries are elastic. This is a figure showing the gradual increase in a measure called pulse wave velocity as persons age. So with stiffer arteries, the propagation of a pulse wave tends to increase in speed. That's what this shows. And it can be assessed using PPG. So this is the PPG signal seen in a healthy young person, of a waveform that those of us who've been to medical school all remember: a systolic peak, a diastolic peak, and a diacrotic notch. With progressive stiffening of the arteries with age, the clarity of this morphology changes. PPG signals employed to predict cardiovascular health indices undergo quite complex signal analysis. There are fundamentally two approaches towards this signal to get inferences after you have pre-processed the signals to get artifact minimized or artifact free signals. And those are to perform feature extraction of a list of features that are informative, or to perform deep learning, which is a black box approach to get at the diagnostic or the features of interest. So these diagnostic features of interest include just categorization of age, inferring pulse wave velocity, which I mentioned is the measure of arterial stiffness, assessing blood pressure. So the reference device for arterial stiffness is a tonometer, which measures the pulse wave velocity, and the reference device for blood pressure measurement is using a cuffed blood pressure monitor. Speaking of monitoring blood pressure, this is important because hypertension is common, it increases with age, and its effective treatment lowers morbidity and mortality. If a person is made thoughtfully aware of their blood pressure and how that blood pressure fluctuates with compliance with treatment and such, this could be of value. Here we see a display of some purpose designed devices that measure blood pressure with a PPG system. These are purpose designed, so their algorithms are specifically tuned for that purpose, and then they don't have other functions like the regular health trackers do. Now, most health tracker devices require some kind of calibration, at least to measure blood pressure. The Actia watch does not, and this is one of its strengths. This is the end of one study performed by the author, who shows that under ideal conditions, a device such as this can faithfully track blood pressure and heart rate over time. The extent to which the signals are closely matched in time by the cuff compared to the Actia device suggests reasonable accuracy. Now, wearable trackers can also be used to estimate vascular age. Jism Yilmaz from our lab demonstrated that the fingertip and aura PPG signals do differ in morphology, but that both of them can be used to infer vascular age with a reasonable mean absolute error. And this estimation is comparable across the two devices in data from 160 participants of adult age. Now, it's important that we recognize that mean absolute error, normally we want the mean absolute error to be low, but in this case, when we are assessing organ age, if it is 0, then you're essentially saying all you're assessing is chronological age. So some level of MAE is useful to inform us that the test instrument is able to provide us information about the measure of interest, the age measure of interest that is different from information we collect from just chronological age. And for more details, you can look at JISM's poster on Tuesday at board 416. So here's a summary of the features that one can use from a wearable health tracker. For resting heart rate, the clinical acceptance is high, and it's been incorporated into several cardiovascular risk models. You just need to get a good tracker and wear it properly. With atrial fibrillation detection, it's good for screening. Adults, it can't replace a doctor, but it's good to for screening, and it will generate some false positives. So that has been noted. Heart rate variability, a lot has been spoken about it, but I deliberately skipped this because it features in some of the other applications as well. The acceptability is moderate because of the large inter-individual and intra-individual variation that sometimes doesn't behave like we expect. And it's good for evaluation of stress recovery and autonomic research. Blood pressure and estimation is an emerging application that hasn't hit prime time, similar to vascular stiffness. This is very exciting, but it is still considered evaluatory. Mental health is one of the largest applications, potential applications for wearable health trackers, and I've chosen depression and stress assessment, as depression is the condition that's probably most closely tied with these with the kind of biometrics you can get from a health tracker, and stress monitoring is something that many manufacturers advertise in their wares. Now, we might have left the discussion of sleep to the previous speakers, but one cannot escape the fact that sleep patterns are a very important marker for depression severity. So this is a massive meta-analysis and review conducted by Scott several years ago, and he found that effective treatment of depression has, improving sleep has a very strong effect on improving depression severity scores. In another piece of work, Fitbit devices were used in monitoring study involving over 200 persons with depression relapse and depression severity with hundreds of days of follow-up. And you can see that measures of sleep variability and variability, that is a change in total sleep time, as well as the variability in total sleep time, but not the total sleep time itself, are useful in predicting depression relapse as well as depression severity. In another study conducted using Whoop devices over 13 months, looking at both interpersonal and intrapersonal measurement of depression severity using the PHQ tool, it was found that longer sleep duration, efficiency, and consistency speak to lower PHQ 2 scores, whereas higher variance in sleep duration and time of falling asleep give rise to higher PHQ-2 scores, which are less favorable for depression. And then similarly, there were findings in in-person analysis that were slightly different from those of the between-person analysis. The investigators also evaluated how the WHOOP assessed perceived stress, and for this, longer sleep duration and higher sleep efficiency predicted lower stress scores. Now, although the plots here look promising, the effect sizes were really quite small, and the functional significance is slightly unclear. Another work of interest is how these wearables can be used for depression screening. And this is work done from Singapore using Fitbits in 290 working adults of mean age 33 years. A range of digital markers were collected. The bottom line was that although the individual biomarkers associated with symptom severity, it was considered that these combined together, the prediction was somewhat limited in predicting depression severity in this sample. Besides the use of sleep and heart rate metrics, this study from the TempPredict study from Aura found that higher self-reported and wearable sensor-associated body temperature were associated with more severe symptoms. There was also a trend of lower diurnal distal body temperature amplitude associating with greater depression severity, but this did not reach statistical significance. The point worth mentioning is because we talked about heart rate, temperature, sleep, and there's also this factor about circadian or variation or fluctuation of these measures over the day. Moving on to stress monitoring in a bit more detail, it's undeniable that high levels of physical training stress, sickness, or alcohol intake will affect heart rate and heart rate variability in the correct direction. So there will be high intensity stress will increase the heart rate, resting heart rate, and will decrease heart rate variability, and ditto for these other conditions. This is well established, but the evaluation of stress using self-rating scales, there is quite mixed evidence using different devices. So these are some companies who advertise that they provide stress scores, but using a combination of data sources. We don't know exactly what they are because it's not disclosed, but the association between ecological momentary assessment, which is quite temporally fine-grained, and passive sensor data in a large student sample obtained using a Garmin Vivo smartwatch suggests minimal to no overlap for stress with wearable stress indicators. So while these are quite exciting to users, they may not be as dependable as we'd like to think. Here's another two reviews about the utility of consumer-grade wearables for looking at mental health outcomes. And the overall comment is that the assessment of depression, while sensitive to the biometrics, is using instruments that are well recognized for research, but most of these studies do not have a clinician assessment. Now, how important this is remains to be seen over time. Let's keep an open mind here. There was also a comment about the heterogeneity of markers and the analytic methods and relative paucity of external validation. But everyone acknowledges that following symptom trend is useful and they can augment conventional assessment measures. So to summarize this section on mental health, there is quite strong evidence that observing sleep patterns, various aspects of it, can be useful in tracking disruption in depression. And there's moderate evidence for some combination of heart rate variability metrics with activity levels and circadian rhythms in monitoring for mood disorders and relapse of depression. The utility of proprietary stress detection algorithms is currently low, and the multimodal digital phenotyping is somewhat still quite experimental. Now, moving on to an application where there's more promising results and certitude is tracking of menstrual cycles and ovulation. The physiology behind this approach is that core body temperature will go 0.3 to 0.7 higher in the post-ovulatory luteal period, and this is the surge in LH, which is also the gold standard for measuring this ovulation, and this is the associated rise in basal body temperature and the rise in the progesterone level that accompanies this. So in a work that reviewed many studies on the use of trackers to evaluate menstruation and fertility using changes in skin temperature, heart rate, and heart variability, as well as respiratory rate, it was found that these technologies do that work quite favorably. And here are two devices that have got regulatory approval for such an application. And this is a figure that I showed earlier, and it shows the combination of changes. The red one is the temperature change, but also heart rate variability, and respiratory rate changes through the menstrual cycle that will help predict the menstruation as well as the fertile window. And this study found that the fertile window was detected with over 90% accuracy, which is very encouraging. The reference method, as I mentioned, for evaluating the results was the LH test. Now, in terms of evaluation of a particular consumer wearable, this one shows that the ovulation estimation, considering cycle length, cycle variability, and age is very favorable in terms of error when the calendar method and the consumer wearable, here the Oura Ring, were compared. You can see the error is admirably low with the wearable compared to the diary under differing conditions. It has to be noted, though, that there is a tick up in prediction with, increased error with prediction with irregular periods. So the take-home messages here with regard to menstrual cycle and tracking and ovulation or fertile window prediction is that menstrual cycle tracking, the clinical acceptance is good, and it's been incorporated into guidelines for patient diaries, but these are not completely, they should be replaced because the passive tracking is very good and very convenient, and the accuracy for ovulation is pretty good. The application there would be for contraception support and conception planning. Pregnancy monitoring and menopause symptom evaluation are potential future applications that are currently being evaluated. And of course, the concern for this application is the protection of a woman's privacy. Moving on to infection monitoring. Here is some experimental data about an inflammatory stimulus having clear effects on wearable recorded physiological signals. The stimulus is the injection of bacterial endotoxin through, or rather the LPS, and you can see temperature, heart rate, and respiratory rate changes that track with the symptom change. Actually, some of these changes can even occur before the onset of symptoms. And here's data from COVID symptom detection using Fitbit and Apple Watch devices in the US. Over 30,000 participants contributed data. 3,800 of them reported symptoms, 54 tested positive, and 279 negative. And these are the AUCs, the receiver operating characteristics. You can see that each of the biometrics contribute something, but when all the sensor data and the symptoms only are combined, you have a modest enrichment of the diagnostic accuracy. So, in the summary of this is acute infections have a robust effect on physiology, which can be captured in wearables, not in guidelines, but accepted by many clinicians as useful. The potential utility longer term is early illness detection, pre-symptomatic monitoring, and population level surveillance, for example, pandemic tracking. Moving on to the last application, physical activity tracking is one of the core uses of these devices. In fact, most purchasers of health trackers are interested in that. So I'm not going to talk about this, but instead I will talk about something that is related, and that's sedentariness. Okay, sedentariness is harmful to cardiometabolic health. And here some data from the North Finland birth cohort, which found that, which observed about 2,000 participants, currently aged about 33 years old, and they found that when looking at specific individual determinants of health, sleep, sedentary time, and physical activity, longer sleep, lower sedentary time, and higher vigorous physical activity are associated with better cardiometabolic outcomes. And you can see this in the lipids, in waist circumference, and body fat composition. Now, what's important for lifestyle change is that substitutions of sedentary time with different movement behaviors became associated with lower body fat, and that's the data is shown here. So that concludes the meat of the talk, and I want to say that I presented you a lot of data, and many people working on data just say, well, just churn more data, and if you can't get an answer, just keep stirring until the data looks right. This is not the approach we want to take. We want to advise that biometrics can inform about multiple aspects of health, including cardiovascular measures, women's fertility cycle, which have established uses, and mental health users require further work. Collection and analysis of longitudinal data will open up new vistas for personalized lifestyle factor counseling. And very importantly, it's important to distinguish information streams that are material to health from just marketing hype. So if you forget, or if you remember nothing else from this talk, I want you to remember this. More data is not the goal. Better sleep, better health, and better lives are. And with that, I just want to thank members of my lab who have contributed to this, mining the information for this presentation, as well as all the work we've done over the years, and our funders. So thank you for your attention, and I hope you like the presentation.